Welcome everyone. Today we're at the culmination of a joint project between Rowe Dental Lab, myself, and Zest Dental Solutions. And today we're going to be delivering a Locator Fixed prosthesis using a new digital workflow that really makes things a lot more efficient, faster, and just more economical to the patient. And what we're doing is we're using a existing validated technology, and that's called ArchBridge. So ArchBridge is the use of some specialized scan bodies that we use a grammetry technique in order to scan the positions of the implants. And along with some other scans using an iOS scanner. In this case, we used a Trios. We're able to merge these files and create a prosthesis in a digital fashion. This has been used for a long time now, very successfully. And now we're adapting this technique to locator abutments. And so now we've made some new ArchBridge scan bodies for locator. And what we do is we take these scan bodies and we use the black inserts from Locator to snap the scan bodies onto a locator abutment for a full arch type of a case. Now this can be used to take an existing patient that has an overdenture who maybe wants to convert to a fix. So you can scan the existing overdenture, scan the opposing, scan the bite, do a 360 scan of the overdenture. We can send this information to Rowe, they can merge the files, and then they can fabricate a Locator Fixed prosthesis. This is a non-removable fixed prosthesis, and the prosthetic is delivered to us with the black housings already in place. And this is a big advantage because typically we have to fabricate the prosthesis, bring it to the mouth, pick up the inserts in the mouth, and that's a long, laborious process. So this saves a lot of time for the dentist, and as we know, time is money. So today we're going to bring in a patient who has an existing Locator Fixed prosthesis. It's a zirconia prosthesis, and we're just doing this today to validate the process, to make sure that everything fits, everything snaps in well. And so what we're going to do is in going back to the initial appointment, what we did is we scanned the patient's opposing upper, we scanned the lower prosthesis, we scanned the bite, and then we removed the zirconia prosthesis. We did a 360 scan, meaning both the occlusal surface, the buccal lingual, and the intaglio. We sent those files to Rowe to merge, and from that, they fabricated a Locator Fixed prosthesis, and this material is going to be Ivotion. So today we're going to take out the existing zirconia Locator Fixed. We're going to try this in with the black housings to make sure that everything fits perfectly, and then if that fits and snaps in well and the bite is all good, then we'll place the permanent inserts that will enable this to be a Locator Fix that the patient does not remove. Okay, I want to introduce our patient Tom. He's graciously come in to help us validate this new ArchBridge Locator digital workflow. And so I'm going to show you what we've done up to date. We're just going to put some retractors in here. Close together, Tom. Oops, I'm sorry. Okay, close together. So Tom has an existing upper denture and a Locator Fixed monolithic zirconia. And he's doing great with this, and he's graciously offered to help us to validate this workflow. So what we did at his last appointment was we did a trio scan of his upper. We did a trio scan of his lower. We did a bite, a scan of his bite. And then we removed the monolithic zirconia prosthesis and we did a 360 scan. So the occlusal, the buccal, the lingual, and the intaglio. And then we sent all that information to Rowe to merge the files, and from that, in one visit, we're fabricating a new Locator Fixed, and today this one's going to be an Ivotion denture. As we've talked about, there's many different types of materials we can use. For this demonstration, we've decided to go with an Ivotion. So just go ahead and close, tap a couple times, Tom. Tap, tap, stay closed. Perfect. Stay right there. Okay, that's good. Okay, so here's the prosthesis that we're going to seat today. And as you can see, we have the black inserts. And you always want to leave the black inserts in so that you can make sure that the prosthetic fits, so you can check the occlusion. And then once we verify that it fits with the black inserts, then we'll change it to the blue and tan inserts as is indicated, for this type of a prosthetic. So I'm going to just take his upper denture out so that we can get it out of the way. And then we're going to use our Locator Fixed removal and insertion tool. It has a little wire on it so that we can loop around the intaglio of the prosthetic and pop the prosthesis off one by one, going from insert to insert. So this just loops around. And what you want to do is you make sure that your assistant's holding down the other side, because you don't want this to fly out of his mouth. And you're going to just give this a click. Okay, now we're under the prosthetic very nicely. We're going to give this a click. As you can see, the wire moves across to the next insert. Give it another click. Then it'll move to the next one. And we have one more to go. Okay, so here we have our previous Locator Fixed monolithic zirconia, and as you can see, we have tan housings in the anterior and posterior sections, and we have blue housings in the midsection. Okay, so as you can see, Tom does a great job of cleaning. Tissues look good, the locators look clean. In the normal workflow, we would have to place our processing caps and our inserts onto each locator, block them out, and then do an intraoral pickup. And this can be a long procedure. So the glory of this is that we already have the black inserts placed in the lab through their proprietary process. So when you first place this in, you're just going to kind of find where those inserts and get a feel for if they are lined up over the locator abutments, and then we're going to push them down with our fingers. Make sure they all insert. You could kind of feel a little snap. You can't really hear it on this video. And then we're going to take our seating tool, and we're just going to go to the most posterior side, and we're going to give it a little click. And usually we go 3 times. And then we go to the back one on the other side. We go 3 times. And then go to the front. And because these are the black inserts, we don't really need as much force, so I don't really need to go 3 times because I can feel this is in place. All right, so now I'm going to place Tom's denture back in so we can evaluate the occlusion. Let's put those retractors back in. And now go ahead and close together, Tom. And it looks pretty much dead on in terms of how it was compared to the first prosthesis, so I think we have the occlusion. Typically, we will do a little occlusal adjustment if necessary. Go ahead and open again, close again, tap, 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 and stay closed. Okay, close again. Okay, now open again. All right, now that we see that everything fits well, now we can change to the permanent inserts, and I'm just going to see if I can remove this with my finger since the black housings, and you can see how well that fits. So now I'm going to use my tool again. Yeah, keep that in there, keep it in. So you can see that this removal tool works a little quicker when you have the black inserts. And now we're going to exchange these inserts for the permanent inserts and then place this in a permanent fashion. Take those out. All right, so now we're going to take out the black inserts, and this is a wonderful device called the Locator Insertion and Removal Tool. And what it has is it has a little end to it that expands and contracts. So we'll place this into the black inserts. We'll turn this tool in a counterclockwise direction. It'll expand, grabbing that black insert and removing it very simply. Unscrew it to allow me to insert it again into the black insert, and we'll just take these out one by one. So as we discussed, we use different color combinations with the inserts for the final prosthesis. Because there are more than 4 locator abutments in this case, we're not going to use the green housings, the green inserts, because the green inserts are used when there's only 4 abutments. So this case we have 6, and then what we're going to do is we're going to use the tan housings on the distal and anterior sections. And what you want to do in these cases is always use something to cushion the prosthetic when you're placing the inserts, because you're putting a lot of force on these and we don't want to break them. So we're going to place a tan housing here, a tan insert, I'm sorry. And then for the midsection, we're going to grab some blue inserts. And then for the anterior sections, we'll use the tan housings, tan inserts. And then again for the midsection, we're going to use a blue. And finally, another tan. Here we go with our combination of blue and tan inserts, and this is ready for delivery in the patient's mouth. Okay, so now it's time to seat the prosthetic. Just like we did with the black inserts, we're going to bring this into position, kind of find those abutments. And I'm just going to push down just to get them kind of in place before we use the insertion tool. All right, so now we have the prosthetic in place with just manual finger pressure. Now we'll take our insertion tool and do our little 1, 2, 3, and go to the other side. 1, 2, 3. 2, 3. Okay. Okay, now we'll just place Mr. Dorsey's denture back in. Go ahead and close together. Let's close normal. Relax your jaw. Close right together there. Good. And open again. Close again. Right there is perfect. Okay. Looks like our bite is good. Our overjet is good. And so here we have a successful locator fixed using the ArchBridge digital workflow. All we would do next is just do a few occlusal adjustments if necessary. Make sure that all the teeth are in contact. All right, so in summary, we tried the prosthetic in with the black inserts to verify the fit, to verify the occlusion. That went well. And then we placed our permanent inserts, the tan in the both posterior and the anterior positions, and the blue in the midsection. Delivered the prosthetic using our insertion tool, and so now we have pretty much a duplicate with a different material. Now again, as I said previously, you could go from a overdenture using this technique to a locator fixed. You could go from an overdenture for a patient who's maybe worn down the prosthetic or it's become discolored and make another overdenture. Or you can go, as we did today, from a locator fixed that maybe we wanted a prosthetic in a different material, or maybe the patient wanted to change the shade, or maybe we wanted to improve the occlusion. So this technique works very well for no matter what workflow that you want to use, and no matter what type of prosthetic you want to use, both removable and locator fixed. How's that feel, Mr. Dorsey?
Feels really good.
Okay. All right. Well, thank you for helping us out.
You're welcome.